All right, I guess we'll get going. Good morning. This is Chief Pauly from the Fire Department, Co-Emergency Management Director for the town of Wellfleet. This is November 16th, 10 a.m. This is our monthly emergency management team meeting where we'll have updates from different town departments and to include any new COVID-19 information. I'd like to see if Chief Hurley has anything he'd like to add or say good morning.
Nope, just good morning to everybody. Thanks, Chief.
Okay, you're very welcome. So we'll start as we always do. We have an agenda that runs through about 9 different departments or segments. And we'll start with Hillary from the Health Department. Good morning, Hillary.
Good morning. I hope everyone is doing well. Let's see. I think I have a little bit to spit out today. So I want to start by thanking everyone for their cooperation and wearing their masks and staying apart. And I do want to touch upon the holiday season that's upcoming and make sure folks realize that we are not recommending that you travel out of state or gather in large groups. So the indoor gathering has been cut down to 10 people. And it's going to be difficult for a lot of us. I think we want to gather with our family and friends. We miss them. We haven't seen them in a while, but please, let's try to stay distanced if possible, perhaps meet them online, have a phone call, FaceTime with them, and please try not to gather. That being said, if you are still planning to travel, which I know some people are, I've gotten a lot of emails from folks coming into town from out of state asking what the guidelines are and what to do to stay safe. So we know that the list of states changes pretty rapidly as to who's on the good list, who's on the bad list, or the safe list, or the unsafe list, however you want to look at that. And on my last call with the state, as I understand it, New Hampshire and Maine will be added to the list next, sometime over the next week or so, possibly. So this past Saturday, New York was added, Washington State and Washington, D.C. were added. So there aren't very many places we can travel to without coming back to Massachusetts and requiring a COVID test, and that's the PCR test. So that's the test that takes 3 to 5 days to get a return on. That's the test that's not covered by insurance if you're traveling, but it is required. You also are required to fill out a travel advisory form that can be found on the Mass DPH website. If you're having trouble finding it, please do reach out to me. I'm happy to get you the information that you need. And in the absence of the test, you are required to quarantine for 14 days. So that's probably going to come up more often than not over the next couple of weeks as we get into Thanksgiving and Christmas and Hanukkah and whatever other holidays folks like to celebrate. So if anybody has any questions, please reach out. That being said, we have had 4 active cases over the past 2 weeks, which is displayed on the DPH data. We've had over 120 tests completed, and we are still in the gray coloring, which means we're not seeing so much for community spread at this moment, but I think it's all around us and it's coming, and we just need to be aware and protect ourselves and follow good public health practices. So with that, I'll stop for now. If folks have questions, I'm happy to answer them, whatever I can do to help.
Okay, thank you, Hillary. Do we have, I'm sorry, Courtney, do we have any pictures? I'm sorry, any questions for?
No pictures or questions yet.
Oh, thank you. That's like the Hollywood Squares, as we've said before. Lisa
we do have
Kane, I
one.
believe, is on from Outer Cape Health. Lisa, do you have an update?
We just got one question, and
Okay.
then I can. This is from Lydia. Go ahead, Lydia. Lydia, I just unmuted you. Can you speak?
Hi, this is Lydia. I live, Lydia Kotak. I live on Lieutenant's Island. I'm interested in emergency management, obviously, because I'm in the Medical Reserve Corps. I did put that in the chat. But it's interesting. I've been trying to make sure that we are part of the Civic Plus, and we've been having difficulty with that connection. And it just so happens on Facebook today, I saw that you have this meeting. And so I figured I would want to just look in on it. And I one thing I missed, I don't know, there was like a glitch. you were talking about COVID testing. Did you say that there was free COVID testing? If you're traveling, what did you say about
No,
COVID
I
testing?
did not say there's free COVID testing.
Okay.
Unfortunately,
You just, because that part blanked out. So
yeah,
the
so
co-
I can tell you, as a county, there's a small working group with representatives from Senator Peake and Senator Sears, or Representative Peake and Senator Sears' office.
Okay.
And we are working on bringing more testing to Cape Cod. We know there's a shortage. We know it's not easily available or readily available. We know CVS is offering it, and I guess there's another like medical center in Falmouth that's offering tests for travelers. But we are working to get some funding onto Cape Cod for testing. We have unique situations here that we feel warranted, and there will be some money coming. There will be hopefully a testing center in Falmouth that was part of the contingency of one pile of funding, and another pile of funding is going to go to the county to sort of administer testing there. It's not set up yet. We're working on it. Every week we have a meeting to talk about it, but it's coming. It's just not here yet, and it's probably not going to be here in time for Thanksgiving, unfortunately. So there's a lot of balls in the air, but we're working really hard to get more testing available down here.
Okay, thank you, Courtney.
All right, and Susan Spear, did you have a comment, question as well?
Yeah, I have a question for Hillary. I'm one of a group of 5 health professionals who are providing services to the town through the well line. So we hear from people who have questions and concerns and worries and all the things that we all have. Some of you call us. We are hearing a lot more anxiety about the 4 cases that Hillary just mentioned. Understanding, of course, all the restrictions on a person's right to privacy. Hillary, is there anything more you can tell us about where these people might have traveled to, if they're in a setting where they're likely to come across lots of us, as in a school or a business or any number of places in town? Obviously, no one wants to know who they are, but we would like to know, for the sake of the people who are calling us, and for ourselves actually as Wellfleet residents, if there's anything more you can tell us that will help us know if we should take any steps, if we should quarantine, if we should get tested. Obviously, you contacted the people that you knew were in contact with the 4 positive people, but that doesn't mean you contacted all the people who easily could have been exposed.
So perhaps we want to travel back a bit and talk about close contacts just for a minute. So the definition of close contact is anyone who was within 6 feet of another without a mask on for 15 minutes or more. So that is the basis for the contact tracing that we do. We employ the VNA, which is the visiting nurses, to help us in that contact tracing. So we reach out to all of the positives, we gather their close contact information, and we follow up with each and every one of them. That being said, there are people that come in contact with positive cases who are not necessarily at risk, but it's the anxiety and the fear and the worry that makes them feel that they're at risk. So I always think it's important to go back to what a close contact is and what a close contact is not. So of our 4 cases, one I believe today would be out of their isolation and quarantine. So now we're down to 3. Of those 4 cases, 2 were tested for, we're going in for another procedure and just happened to have a test along the way and were asymptomatic. 1 was symptomatic, and the last one I have not gone back online to check up on to see. But of all those people, the risk to the rest of the community was low, extremely low on 3, and I would say low on the 4th. So I don't feel they were out spreading it amongst community members at all. And as soon as we found out they were positive, we were right in touch with them and they were all sent to isolation. So the one case that may have raised alarms occurred within the rec department, and it was a member of our staff, and they were running a program. And we did, out of an abundance of caution, notify the parents of those families as soon as we knew, just so that folks, if they were worried, could discuss the matter with their primary care doctor and seek further guidance, or if they chose to get tested to sort of quell their fears, then they had that option as well. It just comes down to this difficult point with insurance as to what your insurance is going to cover and what it's not going to cover. So I spent a lot of time talking to parents, families, medical doctors in our community, just trying to understand what happened and sort of get the right message out to people. So I know that's a long answer to your question, and I hope it answered it somewhat.
Yeah, that's extremely helpful, and thank you very much for that and for everything you do. I think the people who are concerned think about the situation where, I mean, for example, if I were asymptomatic and I found out tomorrow, I could not give you the names of all the people who came in contact with me unknowing, me not knowing I was positive, them not knowing I was positive. I wear a mask all the time, obviously, when I'm out in public, but not everyone I see is wearing a mask. So, you know, it's just a difficult situation. And the more information, what you were able to just share about the one person, you know, it's very reassuring, I think, to everyone who's listening, and we'll certainly pass it along. But if there were, you know, any parallel kind of information you could share on the others that wouldn't threaten anyone's, you know, right to privacy, like had people been traveling outside of the state or the county, you know, just does anyone work in a store? Or maybe if you could make the statement, no one works in a store. You know, there's just information is power, and therefore reassurance.
Yeah, and I can assure you that based on our 4 cases, all of our stores in town are safe. I mean, I don't think people need to be concerned about going to our stores, getting takeout food, doing any of the things that are allowed and authorized at this point in time. So all of that still remains safe.
And is it possible to know how many of the contacts that were tested were positive, or will we know that eventually?
None in the town of Wellfleet. So we have not gotten any additional positives back. Like I said, we've in the past two weeks, we've had over 120 tests done, and there were only the 4 positives. So I haven't gotten another positive since I wrote to the community last week. So.
Great.
So those contacts have all tested negative. There were some other folks I was concerned about, and they came back negative. So I think we're still doing good. It's inevitable that we're going to have cases in town, right? They're on the rise across the nation. They're on the rise on Cape Cod. 4 cases is still just 4 cases. And I know it's more than we've had, which is alarming and causes anxiety, but I do believe we're still all safe to go about our daily business.
Great, thanks a lot. That's all very helpful, Hillary.
Can I ask a question, Chief, of Hillary? You talked a little bit about what you had to do in this instance and the work that you did to do the notifications when you became aware of a case. And not to dwell on that too much, but is there a protocol that you're following that comes from a larger jurisdictional authority? You know, I had someone ask me, you know, shouldn't word been gotten out, like, you know, within hours of knowing? You know, who designs the protocol for notifications to the community, and is there someone or some jurisdiction beyond us that gets involved in that?
No, so the official notification actually comes through the state. The state publishes data once a week and that goes up on the state website. There is no sort of, when this happens, do this type of protocol. So we try to do what's best to get the most accurate information out at the right time. So, you know, when we had the case within the rec department, while we knew that none of the children were close contacts, we still wanted to let them know. And it's better to hear it from us than it is to hear it word of mouth through the community. So,
Absolutely.
so I think it's more about trying to get in front of it with accurate information, because we know that the fears and the anxiety are running high, and especially high when it's our kids, and you know it, and we can't control it, and we don't completely 100% understand. So there is no set protocol for notification. We just do what we feel is appropriate and best at the time, depending on the situation.
Right, and the accuracy of the information, so we're not alarming people unnecessarily.
Yes.
The difference between close contacts and everybody else.
Yeah, because in that particular instance, people sometimes read and hear what they want it to say, and they don't understand what we're actually trying to tell them. So that's the difficult part, because, you know, when I was in contact with the school, the information had gotten mangled on its way to the school from a family. And so the school thought that we had all these cases of close contact and made a decision before we had time to talk about it with them. So it is important
Right.
that we get the right information out so that people understand what it is we're trying to tell them. And no matter how hard or how delicate we write the information, it still can get misconstrued in translation. So that's why if folks have questions, it's best to call my office, call my cell phone. I'm here to help.
Thank you.
Courtney, do you see any other questions for Hillary?
Nope.
Oh, okay, this is going, you know, to be probably one of our longer meetings, the way things are happening, and that's fine. I just wanted to say, you know, Hillary has been managing this program, this process since March. So we're 9 months into this, and I think she's done an extraordinary job. She and I are in almost daily contact. When she gets information, she passes it on to myself. I pass it on to Chief Hurley. We notify dispatch. So there is a process. I think, again, it's worked well so far. I believe Hillary is correct. And I'll turn to Lisa Kane in a minute here, or a second. You know, we are going to continue to see more cases. It's just that time of year with the cold and people being inside. But if we continue to do what we've been doing as a community, which we've been pretty successful, I think we've been very successful at, was well managed throughout the spring, summer, and fall. I'm optimistic that we're going to do okay. And I'll leave it at that and ask Lisa. Good morning, Lisa, if you have any comments or any guidance for us.
Good morning, everyone. Thank you so much, Chief. I think Hillary did an absolutely wonderful job at covering all of the issues, you know, going on here in Wellfleet. And indeed, you know, things are shifting and changing, and all across Barnstable County, you know, the case rates are going up, and you don't have to look that far across the Sound to see what's happening in Martha's Vineyard and Nantucket as well. And I think I just want to reiterate some of the things that Hillary was saying. I think that the most important thing that we've learned, I think, over these months is that masks really do make a difference. And I think that Susan Spears' questions about knowing who you might have been in contact with or what counts as a close contact, those questions really, if you're wearing masks whenever you're around other people, that increases your safety and reduces the risk of transmission so dramatically that I just think it's clearly one of the most important things that we can do. And, you know, it's challenging to think about maybe wearing masks inside your own home if you're having people over, or if you're going to someone else's house and, you know, wearing masks. But I think, you know, the possibilities that people are asymptomatic and yet are still shedding the virus, we know that that is possible. And so I think the most important takeaway from any of these discussions that we're having is that people need to wear masks, and clean masks ideally, and they need to wear them so that they're well fitting and they're covering your nose and your mouth. And, you know, hand washing, of course, remains so important. You know, I think, and, you know, again, all of these things that are, you know, being said all over media, and, you know, trying to be outside, reducing our opportunities for close contact, you know, indoors. And, you know, Thanksgiving and the holidays are going to be very different this year than they have in the past. And I think it's our obligation to do that, to maintain a low community spread. So we ask at Outer Cape Health Services, you know, we're here for the community, and we ask for everyone's support by following these really important public health guidelines. I don't have any additional information to add to Hillary's, but I'm happy to take questions.
Looks like Helen Miranda Wilson has a question. Helen, you need to unmute. I unmuted you and you hit mute.
Okay.
There you go.
Hi, good morning, everybody. This is also for Hillary. So I don't live in fear, but I'm living very cautiously. I accept that this holiday season is going to be different than others, and I'm not feeling disappointed by that. I'm just asking myself, how can I do it differently so that I enjoy it? Here's a question to department heads. A number of people on staff and a number of my friends, because we've all been talking about this, are going to have Thanksgivings that aren't like 14 people, but they're a few people. You know, they're going to be people, you know, the son is coming back from the college. They're going to be more wild cards. There are going to be some groups. Normally, let's say if your kids came back from a college in another state, they would be quarantined for a couple of weeks, depending on the state. Maybe they're staying there, who knows? We can't possibly police all that. And I don't operate in relation to people within the staff context in a kind of, you know, policing you know, dynamic. But would it, here comes the question. Given that it's winter, given that it's surging, given that more people are going to be together in groups for short periods of time, would it be possible to put a word out to staff through the department heads to just say to staff, look, if you're going to do this for the holiday and the people that are showing up haven't been tested, and even if they have, you know, their viral load may be subpar, so they may be infectious, but it doesn't register. Would it be possible to ask staff to simply work from home for the quarantine period, or to at least report that they're having group events within their family that bring in people outside of their pod, outside of their bubble? In other words, that's information communication. Everybody is made more aware of the situation by highlighting it without saying, you can't do this. Of course we can't say that, and I wouldn't want to personally. Is there some way to have that happen? Because I don't think it's already happening. Okay, thank you. That's my question, specifically to Hillary and to Lisa.
So along those lines, Helen, I did send out a quick memo yesterday to the staff, not asking them if they're going on vacation or tell me who you're having Thanksgiving with kind of detailed information. Just, hey, we don't recommend you gather. I know some of you were going to, and I sent them the link to the state travel advisory and, a quick blurb about what new states were added to the list. I worry that people are going to begin to feel like they're Typhoid Mary and are going to stop telling us anything if we insist that they tell us a little bit of information. So I guess I'm thinking, as far as our staff is concerned, there aren't so many of us where we don't communicate with one another. I don't know how I'd feel compiling a mandatory list of where folks are going and who they're gathering with, because I don't think we'll ever, I don't think it's going to help us in any way moving forward. I think we have to be smart. We have to follow the public health protocols that are in place and understand if you choose not to do that, then you're putting yourself and other folks at risk. And then you really do become Typhoid Mary. So we just have to be smart about what we're doing and follow what the governor's telling us to do and what we know is the right thing to do. Folks are going to travel. They're going to come and go. I mean, I myself was caught in a wacky situation this weekend where I was in Maine, and on Saturday, the state of Maine decided that people from the Commonwealth are now on the not safe list. So, I mean, I think we're going to continue to get trapped up in this, and we just have to roll with it as it goes and make sure we stay on top of it. And the onus is on each and every one of us to do our part and look and see where we're going or who we're socializing with, and ask the right questions and do the right thing. So, I'm not sure that answers your question directly, Helen, but I think it's the best I can offer.
I'd like to add a comment. I think that's absolutely right, Hillary. And I think one of the questions Helen had was, can we ask employees to stay home for 2 weeks following holiday gatherings? And I think, to your point, Hillary, every employer has to make sort of their own decisions about how how much they ask of their employees and what the requirements are of employees, and obviously making sure that you're keeping the operations of your business and your town going. You may not be able to have people really work from home necessarily. From my personal perspective, I think one of the things that we've learned here at Outer Cape Health Services, and I think other organizations and municipalities have learned this as well, is that if you feel at all unwell, it's very important to not go to work or to school. So even mild symptoms should prompt people to not go to work or school and to stay at home and reach out to their healthcare provider. So I think that that's really important. And I think that perhaps early on, people were more willing to do that. And now people are like, well, I had a sore throat, 3 months ago, I got tested, it was negative. And so I have a sore throat again. And, I'm just going to do what I would have done pre-COVID, just go to work and tough it out. Right. And I think everyone needs to take that personal responsibility. We need to encourage all of our coworkers and employees that if you're at all feeling unwell, stay home. And beyond that, just getting together with people by definition isn't necessarily going to spread COVID. If there's nobody in the room that has it, then no one in the room is going to get it. And without, really, really widespread daily rapid testing of every person in the United States, which clearly we don't have, I think that it's personal responsibility and following public health measures, as Hillary said, that we need to follow.
Hi, may I respond to that? I was just highlighting the fact that you can't eat with a mask on, and new people will be coming into, albeit smaller perhaps, group situations And I was just querying whether or not staff should remember that that adds risk. And the fact that most people are asymptomatic, that have it. In other words, you don't have to have symptoms to have it. But that said, I agree with Hillary, mandating stuff, that's what I meant by, I can't see policing people, which is a term that gives disrespect to Chief Hurley's department, but you know what I mean. In other words, it shouldn't be mandated that you tell people if you've had a Thanksgiving meal with 4 people who aren't in your pod, even if they were asymptomatic. That's the situation I was bringing up, but we've discussed it fully, and thank you for addressing it.
Okay, Courtney, do we have any other questions that you can see?
Nope.
All right, thank you very much again. Thank you so much, Hillary and Lisa. We really appreciate your expertise and your insight. It's been invaluable. Next, we're going to move on to the Department of Public Works with Mr. Norton. Good morning, Jay.
Morning, Chief. Good morning, everybody on the call. I have a few COVID-related items to go over and then some department-related updates. First off, the DPW continues to work at full staff while adhering to standard COVID policies, as we've been doing the past, 6 or so months. In addition, due to COVID, most, if not all, of our continuing education classes have been canceled for in-person learning. So we are in the process of setting up a training room in the DPW garage that will allow staff to watch training and continuing education webinars to stay current on safety measures and also to receive continuing education credits for various licenses that our employees hold. So we're in the process of doing that. We continue to work with various agencies on complex projects such as Herring River Restoration Project. We attended a meeting last week for an RFP that they're looking to put out for construction management. So we're giving them input on that. Last Friday, we submitted a Maya grant for disinfection technologies pertaining to UVC applications for the HVAC systems in various town buildings. We should be hearing by the end of the month if we receive grant funding for that. We're also working with our consultant on a BRIC grant, which is a building resilient infrastructure for communities grant for a generator at the COA. We're working with the Energy Committee on that as well. Let's see, we continue using our misting machine on town buildings and office spaces. We actually just purchased a second misting machine for our second custodian so they can have full use to those for sanitizing office spaces, and it's been working out really well. It's actually the same equipment that the schools are using, so it's a great tool to have. Just some news this month, we're crack sealing around town. You've probably seen the trucks out there now. We will also be crack sealing Newcomb Hollow Beach parking lot and LeCount Hollow Beach parking lot on Thursday of this week. So those will be closed from 6 a.m. to 3 p.m. So just plan accordingly, please. Thanks to the Wellfleet Police Department for the all the details for this work. We appreciate it. And then in addition to that, we're also assisting the harbor master with the removal of floats at the harbor for the winter. And the transfer station continues to function successfully. And we'll be meeting with the Board of Health tomorrow to discuss pay-as-you-throw and some COVID-related items. And then lastly, as some of you might already know, Kevin McCarthy, our highway foreman, has resigned from the DPW effective November 27th. So if you see him this week, just wish him well on his next endeavor. And we appreciate all the service he's had here and for the past 8 years, and we'll miss him. So just wish him well if you see him. And that's all I have, Chief. I'm here for any questions.
Any questions, Courtney?
Nope.
Okay, thank you, Jay. Appreciate it. We're going to move on to community services. And first we'll go with Suzanne Thomas, then Becky, and then Jennifer from the library. So it's all yours, Suzanne.
Good morning. I have Little to report, everything is status quo. We're continuing with our Food Friday meal deliveries to almost 50 people who are living alone or who are being cared for by a caregiver. We had a successful flu clinic, the VNA and Cape Cod Healthcare, our very first drive-through flu clinic, and it worked out really well. Thanks to the DPW and all the giant cones that they delivered to help us align the parking area. We also are growing our email contact list. Thanks to the pandemic, people are realizing that there's things at the Council on Aging that they can benefit them or that interest them, and they're being added to our mailing list, email and hard copy. So if anybody you know can benefit from our information, please have them call and we'll either put them on the hard copy list or the email list, whichever they prefer. In vouchers, there are Social and Human Services, there are 26 3 and 4 year olds enrolled in the voucher program this year. And the other social and human service agencies have been awarded their grants for this year, so they're going to get their first quarter payments soon. In the beach program, it's winter, so there's very little going on. And at this point, I just turn it over to Becky because she's available here for talking about recreation. Thank you.
Good morning, Becky.
Good morning, Chief. Thank you. Good morning, everybody. I just wanted to let you guys all know that all of the members of our department have tested negative. None of us were close contacts with the person that our part-time employee that had tested positive, but as a precaution, we all got tested and we all quarantined for 14 days. I want to thank the community and the parents for their support during this situation. I got an email from one parent who was in the class with the affected person, and she wrote, I hope you are all well and safe. Thank you for all you've done for our children during this time. Before I get to our actual summary of what programs, I just also wanted to quickly say there are risks in offering live programming. We've been following the safety protocols all along since the summer. And the benefit of being able to offer the children some sense of normalcy by providing ways for them to participate in after-school programs with their friends, if they can be done within guidelines, is worth the effort. I'm very thankful to be working with Hillary as she helps us strike this balance between, the mental health and offering some activities and operating within the protocols. So thank you so much. And so to get to the actual programs, the fall activity sessions ended the first week in November. We had 76 children participating in 7 different activity sessions outdoors at Bakersfield. We held the 20th annual Shuck and Run 5K. Road race was held virtually through the month of October. Inspired by artist Ellen LeBeau's creative t-shirt design of oysters wearing masks, 60 runners participated by running a 5K race and competed for prizes by submitting their times and routes. Who knew that virtual races would be so popular, but that one, the 20th annual, got off without a hitch. The department hosted a successful Halloween celebration for Wellfleet families on October 31st at the town pier. With all safety protocols being followed, over 100 children were able to show off their costumes, participate in spooky dancing and distanced Halloween games, and receive goodie bags. Many thanks to Will and Jamie at the Harbor Master's office and the Wellfleet Police Department for assisting us with this effort. And of course, Hillary for her guidance in this event. The playground, skateboard park, tennis court, and pickleball courts are still getting well used with the mild fall weather. And again, I want to thank the community and users of the area for being respectful of the rules and the protocols down at the park. So we're glad to have that facility available to the public. The department is working with the Nauset Middle School to set up a weekly study pod for Wellfleet students whose parents work during the day. More information will be available on that as soon as possible. The department is also exploring a variety of virtual and some live outdoor activities that can be held during the colder months as well. So we're still here. We're still trying to make it happen and to be connecting with the community any way we can safely. So thank you so much, Chief.
Thank you, Becky. I know the things that you guys have been able to do over the fall have really made a difference for the kids and for everyone in town. So it's much appreciated. Any questions for Becky, Courtney?
Yeah, Hillary has her hand up, and then Janet Drohan.
Great. So I didn't want to talk about rec. I just wanted to give a reminder that at our Board of Health meeting tomorrow, we will again be talking about the pay-as-you-throw bags. The Department of Public Works will be joining us and we will evaluate that. So that's tomorrow at 2 o'clock.
Okay, thank you, Hillary.
Janet?
Janet?
I just wanted to, I'm here to represent 246 this morning, the 246 Community Kitchen. And I wanted to just give you a quick overview of the services that we're anticipating from our entire community for the food challenge this winter. The Wellfleet Food Pantry presently is a non-bedded situation, and they have 2 pickups each month. And there's an abundance of food that has come from the Greater Boston Food Bank. So that is a non-bedded situation, which is new. So anyone can go pick up food if they need it. And, you know, Suzanne's program on Food Friday is working extremely well. Mustard Seed has no start date yet. That was specifically for shut-ins in Truro, Wellfleet, and Eastham. But Suzanne's COA has really done a great job in supplementing that. And of course, Common Table is delivering what I call a brunchy Monday through Friday to 60 people. And 246 Community Kitchen is going to supplement Common Table's brunchy with a quart of soup, a loaf of bread, and a bag of salad for Thanksgiving weekend and Christmas weekend, because they won't be delivering on the day after Christmas Eve and the day after Thanksgiving. So we will supplement and deliver with Common Table a quart of hearty soup to all those people, which is number 60 that Common Table delivers to. And 246 plan for the new year is to begin in January with a program that's called Soups On, and it will be a free takeout process in the parking lot of the United Methodist Church, where we will give out a quart of soup, a loaf of bread, and a bag of salad to anyone who is being compromised through COVID in the winter. And that's the season that I'm worried about. When we see all the givers that happen around the holidays, those people who are food challenged can be helped. It's that after that January to May period of time that we're trying to concentrate on. So I'll keep you posted, and thank you very much for giving me this opportunity.
Thank you, Janet. That's really very important information for the community, and we appreciate what you folks are doing. I guess we'll move on to Jen from the library. Good morning, Jen.
Hi. Hi. Thank you. We are continuing to go steadily along with our curbside service. We've served well over 5,000 people with that. And the main thing that we've been doing is planning for our next phase, which we are calling Grab and Go. And the basics of Grab and Go are that a small portion of our library will be open for people to come in for 20-minute periods to browse a small selection of books. There'll be no seating in the library. There'll be appointments for one person to use the computer for 20 minutes. And the idea is just really, as the title says, to grab and go. We're still waiting for all of our safety measures to be in place before we can implement this. And we're also watching the situation with numbers rising and trying to figure out when the best time is to do this, which obviously is a concern. There's one Clams library that just closed for 2 weeks because of a staff member having COVID, and but I'm working towards this next phase and it will happen. I'm just not 100% sure when. We're working with Truro and Eastham. Neither of them have opened in any way yet either. And we are all kind of, you know, in a holding pattern and, you know, wanting to move to the next phase and trying to use the best information possible to move forward while keeping our staff safe and the public safe, and get everybody the materials that they want, which we already are providing with curbside, and we are going to continue to do. I don't know if people have questions.
I'm not seeing any.
Okay, thank you very much, Jen. We appreciate your updates. Next, we're going to see if we have someone from the Shellfish Department on for an update from the Shellfish Department.
I'm not seeing any of them on.
Okay, we can, if we don't have someone come on, in the next few minutes, we can certainly circle around at the end of the meeting. Real quickly, an update from the fire department. Last month, we did a number of virtual hostings of Fire Prevention Week, educational activities for the elementary school aged children. This was the first time we were able to, was the first time we've had to do something like this, but it went over very well. That was pretty much spearheaded by firefighter Justin Kinshaw. So even through COVID, we were able to get fire prevention education and activities out to the youth and those in the schools. We've just finished up our capital improvement plan budget proposal for FY22, and we're putting the final review, doing the final review of our operating budget for FY22. We're down 3 full-time positions. I hope that we'll be able to start to advertise those towards the end of December and start interviews hopefully in January to fill those positions. So we are running a little bit short-staffed, and we're doing the best we can with that. In terms of personal protective equipment, we have plenty in stock. We're good. So our folks are protected when they're on the streets. And if you see some activity around the exterior of the fire station on the past week and the next couple of days, it's just regular annual hose testing, testing of the aerial ladder, and pump testing on the engines, which is an annual required activity that we do. And so with that, I will turn it over to Chief Hurley for a police department update.
Great, thanks, Chief. Just open up this morning with, you know, obviously we're all at a heightened sense of awareness now with, you know, the winter settling in, the holiday season, the COVID tests starting to increase, and anxiety. The staff does have access to mobile crisis unit, which is a 24-hour unit, if need be, in the field to get services for those that are in need. We also have the Navigator program that we are referring people to. So we are at a heightened awareness now of the stress that is out there in the community. Again, please, you know, either call us or the Navigator. And this morning on the line, I have Susan Spear that's here with the Wellfleet Well line. And if she has a moment, maybe just kind of, again, reintroduce the program, the service that's available, which is awesome for the community, because it really does, you know, help those that are in between that may not need the needs of a Navigator or a mobile crisis unit. Susan?
Thanks, Chief Hurley. It's always a privilege to talk to this group, all of whom are doing amazing work in terms of the town staff and everybody else. There are, as I said earlier, 5 of us mental and medical health professionals who have volunteered to form a group that basically does anything anyone asks us to do. But our specific goal is to provide a phone line for people to call. We staff it live 5 days a week from 9 to 5, and then we pick up messages the rest of the time and call back as soon as we can. We provide a listening ear, a kind of buddy system, so you can call us once, or you can call us and set up a ongoing connection, however often you want it, once a week, twice a week. And then we are running a weekly Zoom group with a trained therapist who is used to doing groups, and that's a drop-in group, so that you just have to look at our Facebook page and see how to drop into that group. This Wellfleet town staff, especially Chief Hurley and Hillary, are working with us in an extremely helpful way. And we've offered this service specifically to all the town employees, to the school parents and teachers, and welcome any suggestions anyone has on what groups it would be important for us to reach out to. I'd be happy to answer any questions.
Great, thanks, Susan. I don't know, Courtney, if you have any questions in the chat, or anybody that may have any questions about the group.
Not at the moment.
Okay, great. Thanks, Susan. Again, great, thanks to you and the group. And, just to let the community know, over the, the past 8 to 9 months, we have had retired medical professionals. We've had current medical professionals that have offline reached out to myself and the fire chief, offering services to not only the town employees, but to first responders. And, as you can imagine, these jobs, the stress that we are typically under normal circumstances, trying to keep staff safe and still responding to the community needs. So again, a big thank you to everybody out there that's been reaching out to us and lending a volunteering ear or hand if needed. Quick update, like the chief said, as far as personal protection gear, the state and MEMA has been great. We just received another shipment this past week. So if anybody in the community, any town departments is in any need of masks or personal protection gear, please just get in touch with myself, Chief Pauly, and we will get that gear to you right away. A quick update on the Civic Ready. I know we had kind of a shaky rollout again after an incident back in September, but we have been working on the system. We are trying to better train staff in using it, and it really is a notification system back to the community. At times it's been known as an emergency notification, but has been used for other instances in town. And a reminder that on our Facebook page, the town's website, there is sign up information. Sergeant LaPence within the police department runs our portion of the system and can help anybody log on and get on. And I can imagine that in the future, if Hillary was able to line up some testing sites or anything that needed to be pushed through in Wellfleet, that we would utilize that. The only concern among staff and myself is that we just don't want to use the notification system weekly or daily to push out information, or else people will be kind of come deaf tone to it. So, through all mediums, social media, website, print, we do try to get all this information out to the community. So just bear with us. It's hard at times to hit everybody, depending on what they're using for their information outlet, but we are trying to get this out to every possible social medium. Kevin LaRocco, Lieutenant's on the line now. If Courtney can unmute him, he just has a quick announcement about our Toys for Tots, which is going to kind of see a different version this year, but we definitely want to have it.
Good morning, everyone. Can you hear me okay?
Yep.
All right, thanks, Chief. Yeah, I just wanted to, not a COVID related, but just wanted to update everyone on the Toys for Tots program this year. In conjunction with the fire department, we will be pushing out and deploying our drop box locations across the local businesses in town over the next couple of days. We're going to take extra precautions and sanitizing these toys when they come in, but I think it's very important this year. I think the children have lost a lot over the last 9 months, and I think getting some toys in and helping them out and the families locally in town will be a good thing this year. So again, in conjunction with the fire department, you'll be able to drop off toys in either one of our lobbies. You don't have to talk to anyone. You can just drop it right in the box. Once we get all the toys, we'll sanitize them. And we're also working with Lydia Kotak with the elementary school and getting these toys out to local families in town as we've done in the past. Any contact information, if anyone wants to get a hold of anyone, it's Officer Michael Allen within the police department and Teresa Townsend within the fire department. We also are planning, hopefully as we've done in the past, a cruiser and ambulance event. Again, with the COVID going on, we're going to be extra cautious and just, hopefully doing this still in the first weekend in December. We haven't come up with a final date yet, but hopefully we can still go ahead and do that and just be cautious and have the drop off just in the boxes only to raise these extra toys for the children. That's all. Thank you very much.
Great, thanks for that quick update, Matt. And just the final thing, I'm sure the helicopter activity that's been throughout town the past few weeks, again, just using this morning just to remind people that that project is going on. Eversource was in touch with myself and the fire chief, just more on a logistics level, not for any town approval, not for any, any other advice except to try to get the word out that they are out there. And hopefully, weather permitting, they should be ending the project later this week, but I will be in touch with the community relations, and if any of that changes, we will push that information out. The landing zone for Wellfleet is 300 Grosse Hill Road, which is their transfer station. So if you're hearing more activity than usual in that area, that's the reason why. But hopefully this project will be a major upgrade for the Lower Cape. And, it should be over in the next week or so. And just in closing, especially to Helen's point earlier, with the first responders and the police, fire, and public works, obviously we're out in the community. We're having contacts on a daily basis with the community, and the staff has been making all safety protocols. But as far as off-duty and personal life, the town and administration has been very supportive. If any of our staff has any concern about close contact or has been to any type of family event or anything where somebody may have tested positive, that we are taking all the extra precautions and quarantining them and testing them prior to bringing them back to work. So, and they are very honest. They're up front. They're coming to myself and the lieutenant and working on that. So I think they realize that we are trying to keep a safe environment here in the department and willing to work with them through quarantine and other options from home. So, and again, thanks to Hillary and Lisa from Out of Cape Health. This is, they call it an emergency, a public health emergency, and myself and the fire chief are great on snowstorms and blizzards and anything else that may come along. But this has been a huge learning curve, and it's, there's no end date yet. So again, thanks to Hillary, we're all in contact daily, weekly, weekends, nights, Maine, wherever it may be. And it's a great team. And I just want to thank everybody again. Chief, thank you. And happy Thanksgiving, everyone.
Thank you, Chief, and certainly Lieutenant LaRocco and Susan Spear for those important updates. Next, we're going to finish up with the town administration. We'll go to the town administrator, the assistant town administrator, then I'll call on the board members as I see them on the call. So good morning, Maria. Do you have anything for us?
Good morning, everyone. Nothing really, just to validate, what staff has already said. Any instance where we've had where folks have needed to quarantine or work from home, I don't know of any of those that haven't been approved or encouraged, whether it be because they had, childcare issues because of COVID situations or whatever it is, that has not been an issue. And I do see folks ask that all the time, but that has not been an issue. Hillary and the chiefs and everyone are doing yeoman's work to get everybody through this without losing their minds. And I appreciate it. So I do unfortunately have someone knocking on the front door waiting to meet with me. So with that, I'll just say happy Thanksgiving to everybody. Take care.
Thank you very much, Maria. Welcome aboard again. Mike Travato, do you have anything for us? Yep.
I've tried unmuting.
Okay.
Are you there,
Period.
Mike?
I am, yeah. All said, nothing related, COVID related, Chief. Thank you.
All right, thank you, Mike. I'll go to the select board members, starting with Janet Reinhardt. Ms. Reinhardt, do you have anything?
Just want to say what a great job everyone is doing. I know it's difficult, and I don't know, these kinds of meetings even bolster my energy. I do want to just remind everybody that many people are getting excited that there's a vaccine possibly coming sooner rather than later. And that because of this, certainly no one in Wellfleet, but there's reports that other people are being a little more relaxed in their safety and COVID prevention, social distancing measures. So the vaccine ain't here yet and we ain't gotten it. So please still be vigilant. Thank you.
Thank you, Janet. Next, we'll go to Ms. Wilson. Hello, Helen, again.
Hey, yes, I want to particularly thank all of you for this valuable public meeting once a month. And I'm even going to announce it at our next select board meeting because it's recorded. It does lift my heart to echo what Janet says. And I want to particularly thank the departments that, in a sense, it's elective. We don't have to have toys for tots. The library could be closed. The rec department could have just stopped everything, and you didn't. And it has everything to do with us getting through this, as Maria said, without losing our minds. So thank you so much, all of you. Thank you.
Thank you very much, Helen. Those are kind words. Mr. Curley, I see you're on the call. Do you have anything for us, Ryan?
Yes, I know that Thanksgiving is going to be hard for a lot of families. I have two very large families on both sides of my family. And I'm really disappointed that we're not going to have a normal Thanksgiving. But it is something that we're planning for. It's just going to be my immediate family and not my larger family. So just me, my brothers, and my dad, and that's it. And it is unfortunate that this time of year that we have to go through this, but it is what it is. And we need to do our best to try to keep everybody safe. Thank you.
Thank you, Ryan. We appreciate that. Courtney, do you have any other questions or see anyone else that has something for us?
Hillary has her hand up.
Sorry, I just wanted to chime in. I don't think Nancy spoke, Nancy Chavetta, the Shellfish Constable, and she's working on a project with my department and the state to bring a shellfish farmers market to Wellfleet on the weekends. The Board of Health will be hearing about this for the first time at our next meeting. So I think it's exciting for the community to begin to wrap our minds around that. It's going to be great for the shellfishermen in town, and hopefully we'll get some folks selling shellfish locally, and we're excited to see what it may bring. So I just wanted to put that out there for Nancy.
Thank you, Hillary. Courtney, do you see anyone else?
Nope.
Okay, so I guess we'll call that a wrap for the November 16th meeting of Emergency Management Team. I'd like to echo others here, wishing you all have a very happy Thanksgiving. It is all going to be different for us. I know it's going to be different for me and my family, but we will get through it. And please have a, again, happy and safe and healthy Thanksgiving. And we'll see everyone soon. Thank you.
Bye-bye. Thank you.